Hi, and welcome to the Business Spotlight series. I'm Martin Baillie, and joining us today is Shola Adeyemi, who's the co-founder and Chief Innovation and Data Strategy Officer for BSmartlytics Limited. Good afternoon, Shola. How are you today?
Good afternoon. I'm good. And yourself?
I'm fantastic, absolutely brilliant. And thank you so much for taking the time out to come and join us today. I really, really do appreciate it.
Thank you for inviting me.
You're most welcome. You're most welcome. So why don't we start our conversation off by you telling us a bit about who you are and what you do?
As you know, my name is Shola Adeyemi, and I'm originally Nigerian. I moved into the UK to do a PhD, and I never left. So
You liked it so much, you stayed.
yeah, and most of my research were, in terms of modeling patient flow, even through my PhD. And at a point in my career, I started thinking most of this research that I've done, they've only been out there in papers, and nobody will ever use them. So I thought, even if anybody is interested in using them, they need to find me to be able to use them. So I thought, why don't we start turning this into easy to use tools that people can, readily use. And that's how the Bohemian Smartlytics Limited was born.
Fantastic. So what was your, I mean, obviously your motivation was to get people start using it. What was your biggest motivation to get the business off the ground?
I think my biggest motivation is that we can actually add a lot of value to patients, to even healthcare workers, because we know that there's a lot of challenges in the healthcare space in terms of how data is being used to optimize patient care. Data are generated in lots of in lot of the processes. However, most of this data is in silos. They are not really pulled together to be able to enjoy the full benefit of actually acquiring that data. And that's why we've come up with a concept whereby we build an integrated technology that actually facilitates seamless sharing of data across all stakeholders within the healthcare space, with the focus on the patient.
Right. Okay. It's interesting. So how do you market this your business? I mean, how do you market to the healthcare system? How do you get them to buy, to engage with what it is you offer?
So there are several media that, by which we market. We use a lot of social media content creation to drive awareness to our product, and also to drive engagement with our company, to learn about what we do. We also attend conferences, to talk about our product and the impact they are making in some of the few projects that we've done. We also engage within our network. So we network a lot, either in the UK among clinicians or even healthcare organizations, peer support groups, to market what we have in offering.
Okay. So you do quite a lot of marketing, and do you test and measure that marketing?
Yes, correct. We try to also send out surveys, and within the social media platform, we review all the analytics. We review what is more important for different stakeholders and as in terms of engagement, and we then use that to tailor materials to those stakeholders.
Okay. And so I mean, you've been going now for what, 4 years? Is that right?
Yes, we registered in 2020, but we did a lot of R&D work, years before that.
Okay. Before you actually brought the business to market. Okay,
Correct.
Cool. So how's your growth pattern been since you started the business? Have you been growing steadily every year? Has it been rapid growth, or?
It's been steady, and I think this is because, when we started, the disease that readily came to mind to start with was HIV. but we had a blind spot that, HIV is mostly felt, the burden is felt in the low-income countries or middle-income countries, and they became our customers. And at the same time, they don't have the purchasing power, to be able to deploy the solution. Most of the funding for taking care of these diseases are coming from international organizations, donor organizations. So we had to kind of, re-strategize to engage some of those stakeholders in terms of seeking for funding to be able to deploy the solution, because most of the governments of these countries, they have really limited financial capability to be able to deploy such an innovative solution. So that has made the entry into the market, not as aggressive as we thought it could be. And sometimes when we actually pitch this solution to people, some of the things we get is that, oh, I wish this is diabetes. Oh, I wish this is cardiovascular. So and that is why the market has been limited to sub-Saharan Africa. But we see steady growth because now we're working with CDC programs in Nigeria. We're working with USAID programs across Africa.
Okay. And is this something that you would you think could benefit people, the healthcare in the UK as well, or do you think it's predominantly other countries?
Yes, correct. This is a global solution that can be deployed across the globe. And because the background technology is built such that it can be tweaked around for any diseases or even any healthcare program. So, for instance, we're working with an organization to do a COVID digital tool in North Africa. We are working with other organizations to look at maternal and neonatal care health. We've also done some work in the Southern Africa on gender-based violence, using the same concept of the background technology to offer solution for these programs.
Right. Okay. Understand. So where do you see the business in the next 3 to 5 years?
I think the business is going to grow very aggressively. Just like I've mentioned, one thing that we're looking at now, which is a global burden, is mental health. So we're trying to, tailor this solution to support mental health offering. And we're sure that this will actually be something that is not only suitable for African market, but also the UK or even the developed world. And like I said, the technology is versatile and can be tweaked around for any health programs. Even other sectors beyond health can leverage on this technology.
Okay. So you're being aggressive. So I mean, so if you believe you're going to grow aggressively in the next 3 to 5 years, or where you see the business in the next 5 years, aggressive growth, what plans have you got in place now to enable that to happen?
So we are making, we are reinvesting, a lot of our resources. We are investing this in the business, and we are making sure that we continue to build our innovation team. We are always ahead. I remember when we started, and we gave seminars. We talked to people even in the UK or in the US. They would tell us, "Oh, you guys are like 5 years ahead." So, and we want to maintain that lead. We want to maintain that lead in cutting-edge technology, and we need to put a lot of resources together. And we're also trying to streamline our expenditure in terms of the cost of the business. So that will also help us to be able to retain much of the revenue that we derive from the technology. So we are forward-looking. We are abreast with the cutting-edge technologies, and we adapt. So our staff are very free to innovate. So we don't put them in a box. So we understand that people who are really tech savvy, they need that freedom to be able to innovate. And as an innovative innovation technology service provider, we offer that platform for people to innovate.
Okay. Okay. So how big a team have you got? Have you got, working on innovation in the business then?
Particularly on innovation, we have about 10 to 12 people working on innovation. This also include a few working in research. So because the team is partly research and partly development, that's the innovation team actually, because you can't take research away from innovation or innovation away from research. So we put them together. But globally, the size of the company is about 20.
Okay. Okay. Wow. Okay. 20 people around the globe. Wow. That must be quite a challenge to manage all these people all around the globe. So how do you manage and lead in that such a remote working environment?
Because we started remote work even before COVID, and we are a technology company, so we identified this far ahead of COVID. It's COVID that is making most other companies to embrace remote work. But we started that, and we have technologies that support us in doing that.
Okay. Are there any specific technologies that you would recommend that people use for remote working?
Everything we've built is in-house. We don't use software. We don't use third-party software in our company. So we build our own tailor-made technology that works for us.
Right. Okay. Okay. Well, that makes sense. I mean, you're obviously data analytics, and it kind of makes sense that you're going to come up with your own technology, doesn't it?
Correct.
So if I was able to give you some magic dust, but you could only put this in one area in your business. I mean, you only get to choose one area. Where would you put that magic dust?
Expansion.
Expansion. Okay, elaborate on that for me. What do you mean by expansion?
So by expansion, like I said, we've got a versatile technology. This technology is not only suited for healthcare, it can also be leveraged in education, oil and gas, government. So if you give me a magic and I need to wish for something, is to be able to have enough resources to expand, to most of these areas. So that would be what I would wish for.
Okay. Okay. No, that's I get that. That makes a lot of sense. Makes a lot of sense. So look, we touched on the fact that you got 20 people around the globe working remote, all the rest of it. So the challenge with that, when you got people in an office, so you got people in the room with you, or in the same space, you can motivate, you can influence, and all the rest of it. So how do you foster a positive and a productive culture within your team? Yeah, especially when you're working in such remote circumstances.
So let's just say what we're doing has been working well. So within the technology, we've got different groups, and within this group, it's like think about it as a Facebook group of people, like-minded people. So, and we've got this many, different groups depending on what people are doing, and we engage through that. And beyond that, we have team calls every week, as well as a town hall once every month. And we also have activities within the organization that get us, like, despite the fact that we're far apart, I think we bond because of some of these activities that we do. We also showcase the interest of our employees, what they are interested in beyond work. People would like to run, and they want to run for charity, or people would like to, there was one of our employee who was going to Mecca. We try to organize, can we understand about Mecca? Tell us what you're going to be doing there. So some things that are even beyond just everyday work. So that actually helps us to actually, bond as a team, and also in different teams. So I think we're doing really well, and we can monitor our productivity, via the technology too, based on different metrics that we predefined. So we're doing really well in that line.
Yeah, no, it sounds like you're doing a lot of good stuff around people engaging with what their interests are, and then aligning, at least showing an interest in what their interests are, which is a lot to be said for that, and a lot to be said for a lot of employers or leaders learning from that as well, because that sometimes means more than a pay rise to somebody, or even more than a well done, because you're taking an interest in something that's very personal to them.
Absolutely.
Yeah, no, absolutely, no, good shout. So look, I suppose the final question for today, just to wrap this up, is how do you want your business to be remembered, and so what kind of legacy are you aiming to leave, Shola?
I think the legacy is that we've built a technology that is filling a gap. And even when I'm dead, for instance, I will be remembered for bringing my research from academic through development into easy-to-use tools. And by easy-to-use tools, this is the most difficult part of the development, if I'm truthful. How do you make a digital solution easy to use? And we achieved that. And we achieved that based even by evidence, because we ran a lot of pilot studies. And what we realized is that neither age nor educational background affect the uptake of this technology. So even you are 65 or 70, or you have basic education or a PhD, it doesn't really matter. All it matters is, do you have access to a mobile phone? Have you used a computer before? These are the only things. You don't really need to be tech savvy. And if that's the only thing I'm remembered for, because of this technology, I will give myself a pass mark.
Okay, good man. And that's a good legacy. That's a good legacy to have. It's all about technology. It's leaving a mark on the world through that technology. So yeah, a great place to end our chat today, I think. So look, all that remains for me to say, to be honest with you, Shola, is some great stuff in there, and just want to thank you so much for giving up your time today to come and talk to me. It's been brilliant. Thank you.
Thank you to you too. Nice meeting you.
And you.